in Radstock, but we cover all of Baines. Can everyone hear me okay? So we run on the goodwill really of our volunteer drivers. Just to give you a bit of an idea, I think last year our journeys we did 3,690 journeys with 584 passengers. So it's although we're a small charity, it's quite a big operation. These are for people who are on lower incomes, who are usually isolated, can't use public transport. I guess we all know that transport is a big deal for a lot of people. And the kind of appointments that we take people to would be medical and health appointments, clubs, activities, respite care for respite opportunities for carers. And we also run a fortnightly social event for our passengers, which is just an opportunity to have a cuppa and a chat. And again, we provide transport for those. So it's door-to-door transport, community volunteers. Probably like many of you, we are in great need of volunteers. I don't know how everyone's, maybe that's something that might get raised, but recruiting volunteers is a challenge for everybody, I think, at the moment. Just doing a bit of a shout out, really, letting you know that we exist if you haven't heard of us. In terms of referrals, we are at capacity and we have got a waiting list. But by all means, it's worth giving us a call if there's somebody on your radar who does need transport in the Bath and North East Somerset area. I'll put the details up in the chat once I've stopped talking, because I can't do two things at once. And equally, if you come across anybody who has use of their own car, who would like to volunteer with us, I think the main thing to say is that we are incredibly flexible. So even if people have got a few hours a week, or they just say, could you just call me ad hoc? So it's very much, we don't ask for a specific amount of time commitment from people. So yeah, just to kind of let you know that we're here. We've also been running this has been my kind of pilot project. We've been running a project to try and recruit young volunteers into our organisation since September, which has been really, really interesting and also very challenging. But we have managed over that period of time to recruit 12 younger volunteers into our charity, of which we're really proud. And I think the thing that perhaps has come out of that is how lonely and isolated many of our young people are in our communities. And that's down to many things. I mean, lockdowns and, various things in that. But I think the other thing that we've really, really treasured is the opportunity for some intergenerational connection. So we've had some young volunteers coming to our cuppa and chat sessions, and it's been a really lovely opportunity to mix up the ages. And I know that we've done, some impact sort of study work around it. And I know that there's been a really reciprocal benefit to those gatherings. So, and that's something we want to continue. So I'll put my details in the chat. Please be in touch if either you've got a person who needs transport. I know you're probably all super busy people, but if you are, or somebody who would like to drive for us, we would really welcome a conversation. And equally, if there's anybody on your radar who's a bit younger, 18 to 25s, we're really keen to kind of keep that energy going, really, of trying to bring some younger folks into our charity. So that's everything from me. Give me a shout if you've got any questions, but I'll leave you to introduce yourselves. Thank you.
Thank you, Helen. That's really interesting. Thank you for that update. Does anyone have any questions, Helen? If you do, as we're going through, if you want to raise your hand, and then when the person who's speaking finishes, I'll kind of know. Otherwise, I'll keep repeating myself, and you get a bit fed up with me. You will. So I can't see any hands at the moment, but so I'll move on to Laura Lewis. Hi, Laura.
Hello everyone. Nice to see you all, and it's my first time here, as normally my MD Sue here. So I'm Laura from Cool Ventures, and we work with the Baines Council to provide small businesses and residents with a fully funded business support. So what we do really, we help businesses start. So if someone has an idea, that they would like to start a business, maybe just turn their hobby into some sort of revenue stream, then we have a whole host of workshops, one-to-one support, business advisors available to help them do that. We also support small businesses. So anyone with a small business, it could be a limited company, it could be a charity, partnership, sole trader. We can help them to kind of grow their businesses, maybe develop marketing support. So it just depends on individuals and the challenges and what they need. So that's what we do. I think the more important aspect of our support for this group is probably our business starter program. So if any of you are dealing with people that maybe are unemployed, and obviously starting your own business could be a great way to actually become employed and earn some revenue. Maybe it could be in the meantime, temporary, until they're looking for a job. So we can really help. I said it could be just if you come across someone with a business idea. And I think with a business idea, sometimes it might sound, oh, I need this, like a really good, amazing business idea to get started, but it doesn't have to be like that. We have a lot of clients that run their own businesses on the side to increase their monthly income. They might have some sort of hobby or some skill that they can use and run the business on the side on their day-to-day job, whether they're working full-time or part-time. So that's what we do. And I just very quickly tell you a little bit of what's on offer. So we call it a business starter program. So we have 4 key workshops to help businesses start. So the first one, it's called Starting in Business, and that's really relevant to most of our clients at the starting point, whether they just have like some sort of maybe aspiration or slight understanding of the idea, or they can had a really like good understanding of what they want to do. And that Starting in Business workshop then can be followed by a business planning workshop if they need a plan. We have a marketing masterclass, we have essential finance, and actually an area of other workshops that could help them. So so that's what we do. But our Starting in Business is the main, and we actually have 3 dates upcoming workshops in the evening, as that really works for a lot of people. One in August, one in September, and we actually just added a face-to-face session 8th of September in Central Bath. As I know, for some people, online environment can feel maybe not welcoming. They might not have a great experience of going to meetings online, and they feel anxious. So we have also face-to-face session for anyone who prefers that. So it's in the morning on Friday, 8th of September, and I'll put all those dates in the chat. So if you have anyone who's interested, just drop us an email. We speak to all our clients, so we obviously receive referrals all the time, and we follow up all the referrals with a phone call, with an email, just to see what is the situation with the client, and which path would be the best for them, which workshops would benefit most. So that's what we do at Cool Ventures. So if anyone has any questions, happy to answer.
Thanks, Laura. Is all the advice you give free of charge to people?
Yes, absolutely. All of it is free. I used to advertise that it's 12 hours of fully funded business support, but as we run a lot of workshops online, that opened us a lot of opportunities to just allow all our clients to access anything we have on the program free of charge. So they can, some people go on to attending everything we have on the program. So like 20 hours, whatever. Some people just might attend one workshop. And with the startups, we also provide a one-to-one session. So if the client wants some more in depth and want to speak to someone, we can do that as well. So we have that one option of a one-to-one too. And that's all fully funded. There's no cost at all. Sorry.
Thanks, Laura. Much appreciated. Next, I've got Anna. Hi, Anna.
Hi, everyone. Good morning. It's a bit late for morning, I think. Hi, everybody. Nice to see you. Thanks for having me. My name is Anna. I work for Clean Slate. We're a community interest company. We've been founded in Bath, and we just recently had our 17th birthday. So some of you might know about us, others may not. So I'm just going to talk a little bit about what it is we do. Basically, in a nutshell, what we do is help people on a low income or households on a low income to become better off. And we do that by helping them increase their income maximization, financial well-being, financial literacy. So whatever you want to call it, it all falls under that umbrella, basically. We're offering a hybrid service. Before the pandemic, everything was face-to-face, but then obviously we had to reimagine it because there was no face-to-face. So we kind of came up with a money health check, as we call it, which is 25 questions that can be answered with yes or no around spending habits and the financial situation that kind of informs a really good oversight of the situation that the individual's in and can inform an action plan how to move forward to help them become better off, quite frankly. So we identify in that if there's any unclaimed benefits, grant checkers, if there's any spending habits that could be changed to a bit more sustainable. One of the big ones used to be changing and utility providers. Obviously, that is not what we're suggesting at the moment because, well, we all know why. But there are other things that we can look at, such as internet provider, different packages there. I've just done that very recently. It was fairly disruptive, but I'm online now, so that's really good and it worked fine. Saves quite a bit of money, so I can highly recommend that. We have quite a few drop-ins in Bath and Baines area. We have one in Bristol, not at the moment in South Gloss, because in Bristol and South Gloss we're finding ourselves in between funding right now, whereas in Baines we're still running strong. Our service is offered, as I said, face-to-face in drop-ins, which can be looked up in our website, but we also offer a lot of hybrid support, like the usual support work or casework, as you would say, would happen over the phone with the clients. Over the last year, let me just get my stats up, we've helped about 856 people, and the average gains that we managed to make for them was £1,200 per person. So that's quite a good gain, I'd say. And we've seen a 60.8% average increase in participants' financial resilience, which is yet another good outcome we've been having. The other thing we help is around employability, and so we focus on those furthest away from the job market. So those people that have maybe a history of involvement with the criminal justice system, homelessness, substance misuse, ill mental health, long-term unemployed, moms, you name it. So those people that you wouldn't usually find at a careers fair because they just don't feel confident that they have anything to offer. So these are the people that we're trying to engage and give the spark back and see if we can find them a role or just help them with CVs and just general confidence in what they have to offer. Another program that we're running is the Elements program, whereas we offer peer workers, so people with lived experience of hardship placements with either ourselves or within the care sector. This comes as a 3-month program with at least 3.5 hours of paid work placements with either ourselves or in the care sector. A lot of relevant free training comes alongside that. So after 3 months, people have managed to, dip their toe in a bit, and in many cases, it creates hunger for more. So a lot of peer workers that we have worked with have now been employed elsewhere, or when possible, obviously, we will keep them on and give them work with us if we have the funding. Another thing we have been doing for quite a while in Baines is handing out laptops for people that were digitally excluded. Unfortunately, the funding for that has run out, so we don't have any laptops at the moment. However, we do have connections, and we're partnering with the Good Things Foundation, which is one of the biggest digital inclusion charities in the country. And we can get people secondhand laptops that way. So we can signpost them to organizations that hand out refurbished laptops and stuff like that. So even though we don't have the brand new ones anymore, and I'm trying to shout that to everybody because it's just become second nature for people to send people our way when it comes to digital access. So unfortunately, as I said, but we still have data sims, so we can give out data. That's still something we can do straight away in our drop-ins. And then another piece of our organization is Quids In, which is a money magazine, which comes out quarterly. Right here, I don't know, it's a bit blurred with my background if you can see it. It's always tricky, isn't it? I don't want you to see my untidy living room, so you might have come across it. It's a money mag, it comes out quarterly, and it's written a very easy read. It's a bit glossy to engage people. It's very thin because housing associations tend to buy it in and put it into their mail outs, and it saves money because it doesn't have much weight. It has useful hits and tips about how to make the most of your money. We also have an online readers club for clients, and we also have a readers club for professionals, just like all of yourselves, to which you can sign up if you would like to. We sometimes have like webinars, and we've been campaigning not too much, but there has been some action happening last summer. It feels like a lifetime. Anyway, I've popped all my details and links for the website and everything into the chat. I should probably say how to refer to us, shouldn't I? Pop on our website, and on the main landing site, a little sign up button will hover up, and you can just click on it. People can either self-refer or other agencies can refer to us. We are usually fairly quick with picking up, but we have a bit of a wait at the moment, but it shouldn't be too long, I think. Yeah, that's us in a nutshell. Thank you very much. Yes, Liz.
Hi, Helen. I'm Hannah. I didn't quite catch your name and the name of your organisation. Did you say it's called Clean Slate?
Yes, I popped the link in the chat. I don't know if you, I think you were fairly early in as well. I can just do it again. I just copy and paste it, pop it in again so it comes up. Oh, that was just my email address, wasn't it? I cannot copy and paste my chat contribution, can I? Let's see, try that again. No, it just copies my email address. If you scroll up in the chat list, there's all the links to our website, to the Quids In magazine, the Readers Club, and everything, and my email address as well if you want to get in touch, of course.
Thank you, Anna.
Thanks.
Lovely, thank you, everyone. What I'll do, I'll make sure that the chat file is shared afterwards to everyone. So if you've not got a chance to write everything down, I'll make sure that I capture that for you. I'll move to Anne Donahue next.
Hi, thanks, Mark. Hi, everyone. I'm Anne. I'm a support officer at the Carers Centre. So hopefully some of you guys have come across this before, but basically we are a charity that's here to support people who are unpaid carers. So that's people who are caring for friends, family, that sort of thing. Quite a lot of our, I guess, target group don't necessarily see themselves as carers. Like we get a lot of people saying, well, I'm just a mum, or I'm their wife or husband's, just what you do. So sometimes for us, one of the first battles is actually getting people to acknowledge that they do come under that role as carer and that they can access all of our services. So if you do have people that you come across that are carers, that are supporting somebody, whether that's emotionally, physically, all those kinds of things, please, consider sending them our way for some additional support, because often people don't come to us of their own accord unless they're really encouraged. So in terms of the kinds of things we do, so I say I'm on the support team. So we run a support line, which is open every weekday morning, and people can call through with any questions about, we get questions about all sorts, to be honest. And actually this morning I was talking to someone who I'm going to be referring to Clean Slate, because that was the issues that was coming up for them. It was around employment. We often refer people, unfortunately, to Swan. I appreciate you've got a lot of people coming your way, but we do often send people towards Swan because a lot of carers are having issues with transport and things like that. But so we get all sorts of questions. We also just get people calling us because they just need to talk. So for some people, it can be really stressful being a carer, and often, you know, there are points where maybe there isn't much more they can do right now to change the situation, but having somewhere where they can just offload and let it out to somebody who's maybe a little bit separate can be really helpful. So that's something we get quite a lot on the support line. We also have a load of free activities for carers. So we have carers cafes, which are basically an opportunity for carers to meet other carers. So they're scattered around Baines. Most of them are in Bath, but there are some others out and about. And we do have some that are specific for carers who are caring for someone with dementia, and also specific for carers who are caring for someone with mental health issues, and also for parent carers as well. So there's a few kind of targeted ones. And then we have, alongside the cafes, we just have a load of activities that are, well, they're all sorts of random things, I'll be honest. Things like craft activities, we've got a gardening group, there's a book group, they do trips out places, walks, pamper days at Amadown, all sorts of different things. And every quarter we kind of come up with a new set of activities that people can sign up for, and that's all free. So that's quite a good offer for people. We also have a young carers service as well. So if often you've got an adult carer, but there might be children in the house that are also supporting. They might be supporting a sibling, they might be supporting a parent. So they can also be referred to us, and we've got a team that do activities and needs assessments and things like that for them. So there's, you know, there's stuff there for adults and for young people, basically. Our team also do things like support planning, where we look at that person's, I don't know, well, the kind of holistic look at their life, what's working, what's not working around the caring role. Are they able to get out and socialise as much as they want to? Are they able to work as much as they want to? And kind of looking at what little things might they be able to do that would help to be able to, for them to be able to be living the way that they would like to be living at that point, while also being a carer. So quite a lot of different things that we offer. But yeah, I would say the main message is maybe helping people get over the fact that they are a carer if they don't think that they are. And it's fine if they contact us and say, oh, I don't think I'm a carer, but, you know, if they can get some exciting free activities from us, it's all good. So send them to us and we would appreciate that. Any questions for anybody? No. Okay. Oh, yeah, Donna.
Yeah, hi, Anne. I am very aware of which I'll probably explain in a moment when I'm introducing myself, that I'm aware of your brilliant service. But can I just ask, carers are entitled to a carers assessment under social services that can also help, as far as I understand, not financially, but things like supporting them in their role. So if they need a little bit of time out, or somebody maybe to come in to provide respite care so they get a bit of a break. Do you undertake those assessments, or has that got to be through social services, those assessments?
So the adult carers assessments are done through adult social care.
Okay.
What I would say, if somebody's wanting one, they do need to make it very clear to adult social care that's what they're looking for, because we do get quite a lot of carers that contact adult social care asking for a carers assessment, but somehow end up getting referred back to us, and we don't do those carers assessments. So we then have to refer them back to adult social care. So I think if somebody's saying they want one, they need to be very clear and upfront with adult social care that is what they're asking for. They're not asking for just general support chat. They want to, which we can do. They want an adult carers, carers assessment. We do young carers assessments. So if it's a young carer, our service has the statutory offer of doing young carers assessments, but that's only for young carers. So adult ones, it's social care that do them and should do them if they're asked.
Okay, brilliant. Thank you.
Anything else? Anybody? No. Okay. Thank you.
Thank you, Anne. Liz Matthews. Hi, Liz.
Oh, hi, sorry, I've got a quick question actually for Anne, if that's all right.
Of course you can, Melanie. Yeah.
Sorry, I was on mute when I said it, and then I realised that I was talking to myself. Yeah, so I'm fully aware of the carer centre and all the fab stuff you do. What I was thinking is you mentioned about how when a carer wants a carer assessment from our social care colleagues, they need to make that clear. I guess the problem with that could be that some people don't know that they need an assessment and they don't, so aren't able to make it clear. I guess there's also a role for making sure training the social workers or the first response team or whatever in when they have that conversation to sort of make it clear that they're entitled to it as well. So I guess so the onus isn't necessarily on the carer to ask for one. Do you see what I mean?
No, I get that. I think it's a very difficult climate that we're in at the moment. And I think, unfortunately, social care are under a lot of pressure, and maybe it's easier if someone hasn't directly forcefully asked for that, to look at other ways for them to get support. And I think that's what's happening. And so I obviously don't quote me on this, but I think so that's why we say to, you know, we do social care should know that they have a statutory duty to deliver that service, and they will know that. But I think maybe what's happening is, if the carer is not asking for that specifically, they're looking at other services that might be able to offer support instead, of which we know we can. But it is that difficult. Yeah, it's difficult. And we do actually get involved in training social workers. So we, part of our team, actually go and work with trainee social workers to try and kind of get across the importance of supporting carers. So we are, from a different angle, trying to up that kind of message that actually carers are really, they're vital. They are vital. If we didn't have carers, everything would fall apart, basically, because people are doing all this support as unpaid carers, basically. So we are trying to get that message out to social care. We also appreciate it's a very difficult time for everybody, and the services are under a lot of pressure. So it's trying to, I guess, work with that and manage that. Is that a kind of diplomatic answer?
My name's Liz Matthews. I am the new Operations Director for All Cycle Bath and West. All Cycle Bath and West are the new Wheels for All. Sometime last year, we moved under the national umbrella of cycling projects and became a charity in our own right and rebranded. We do the same as we used to do, but we're now called All Cycle Bath and West. I'm new in post. I've been in post about 2 months, although I'm well versed in the cycling environment in Bath, and have been for the last 10 years running my own business. So it's really nice to come and join All Cycles and be able to contribute and develop the delivery that we didn't see. Become a trustee of the charity, so I do the day-to-day delivery and strategic inclusion cycling outfit, which is based at Odd Down Cycle Circuit in Bath. We have a fleet of about, I don't know, something like 40 bikes up here, adapted bikes that we can use for running sessions with anybody who is really unable to ride a two-wheeled bicycle. So we cover an awful lot of users. We have people from the Stroke Association. We have groups such as Headway and BEMSCA and BUP, Gateway, lots of different organisations that come and have dedicated sessions with us. We're able to book the track out privately for them, and we're able to get our bikes out, and we're able to get a lot of people moving and enjoying being out in the fresh air, having some activity and some sociability in their week, which is a real benefit to them and real enjoyment. Sometimes I say I get paid in smiles. It is absolutely brilliant to see the enjoyment of our users as they take our bikes around our circuit. We run 2 open sessions a week to which everybody is welcome. They are on a Tuesday between 4 and 5 p.m. here at Odd Down Circuit. That's our Tuesday twilight. And then again, every other Saturday from 12 till 1:30. The way to book for those sessions is through our Eventbrite page, and you can see the dates of the Saturday sessions then. So we had a Saturday session last week. We won't have one this week. We'll have the next one on the 29th. Those sessions are paid. We charge £6 per rider and £2 per carer. If people bring their own bike, we charge £3, and we've got a family rate. And anybody is welcome. So it's really, the really lovely thing is to see maybe a sibling who is not able to get onto a two-wheel bike, use one of our trikes, or an older person sit on our side by side with their daughter, but their kids come along too and their family come along too. So we're very open and want it to be a very inclusive environment, and it is a very inclusive environment. We have a stock of two-wheel bikes for those who are able to ride in that way, but we've also a variety of adapted bikes, means that we can cope with most issues that that people face when getting mobile onto wheels. But we do have a new strand to our charity now. We are so those are paid sessions. We have a new strand to our charity in that we are participating in the Active Way, which is taking part in the Summer Valley, and this is a social prescribing arm, which is funded by Active Travel. So any work that we do in the Active Way in the Summer Valley is free to our users, and people don't have to live in the Summer Valley to access it, although priority will be given to those who live in the Summer Valley if our resources are stretched. But at the moment, anybody from the Baines area can access those rides in the Summer Valley. And the difference between the work in the Summer Valley and what we do at Uddown is that we're out on the public paths, we're on the greenways, we're on the old railway paths. So it's a much more open environment. Our circuit at Uddown is a closed facility that is completely fenced. And you can imagine for some of our users that is very important. It's a safe environment. In the Summer Valley, we are out on the public cycle paths, which provides a different experience for users and riders and can be really enjoyable. But also, you know, we have to watch the safety of our users in terms of being around other people and other riders and dogs and all the rest of it. We have a fleet of bikes now based in the Tom Heighton Park in Bradstock. That happened last week. We have a couple of trikes. We have a platform bike will take a wheelchair that has a motor with it, so it's an E version, and we have an E version of our side by side. So and also a regular version. So the slight inclines and all the rest of it that we'll find on the local paths can be accommodated. So that's a really brilliant initiative. If you've got users who you think would benefit from taking part in that, you're very welcome to come through me. The Rivian booking system that we're needing to use is not yet online. It will be live in the next week or so. And that will be the way to refer in. People can self-refer themselves in, or they can be referred by a professional or by yourselves, or however. You know, there's no restriction on who can refer into the system. So if you want to know more about that, please feel free to get in touch with me. We are just getting that service up and running, and we've done our pilot rides, we've done our test rides. We're hoping to be live with that in the next week or two. So that's really exciting work that's coming up. So two strands to us. Uddown with the Summer Valley, we welcome all riders and their families, and our charity actually relies on volunteers as its workforce. So I'm going to reach out to you guys for help in that domain. We currently have 7 volunteers on our books who seem to come up trumps for all of our sessions and are just absolutely fabulous. We have a volunteer mechanic, we have volunteer trustees. And at the moment, we're looking for a financial trustee, which is a gap we've got in our trustee board. And we need somebody who will volunteer to take that role on. We do have a paid sessional worker who helps here at Uddown, and we're looking for a paid sessional worker to help in the Summer Valley. So if you know anybody who's interested in running guided rides and has some cycling experience, if not a qualification, then please send them our way. We're really keen to get that post filled. I think that's really all I need to say. Anybody got any questions?
Thanks, Liz. That's really, really helpful. And thanks for bearing with us while those gremlins were in the system. I think things are all calmed down again now. So thank you. I'm going to move to Jessie Agnew next. Hi, Jessie.
Hi there. Thanks, Mark. Hello, everyone. Can you hear me okay? Yeah, brilliant. Okay. I work for the West of England Combined Authority. I wanted to come and speak to you today about a new fund that we've got coming out. It's skills funding. It's actually launching next week on the 27th of July. These funds are basically, it's about £2 million that we have coming out. And it's very much around addressing priority skills gaps in the region. it's funding that basically is a combination of what we're calling the Male Priority Skills Fund, but it's also the UK government funding, which is the UK SPF funding. That's a social prosperity fund. The skills provision that we're looking to fund would be delivered from the autumn right through to March 2025. So that's the period of funding that we're looking at. There will be 2 windows of opportunity to apply to this funding. Obviously, I've mentioned that we're launching on the 27th of July next week. That window is going to be open till, I believe, the 10th, 11th of September, and then we'll be doing another launch late September is the current plan. So a little bit more about it. What do we mean when we're talking about priority skills gaps? So there are 4 different themes that we've looked at in terms of the intelligence gathering that we've done so far. One is community programs of support. So that's skills programs that are very much focused on people that are from disadvantaged groups in our communities, and support that's meant to address removing barriers to support them to be able to access opportunities for, you know, utilising existing provision. And it's about removing a lot of those barriers that may be in their lives to be able to provide that wraparound support and really help guide people and support people towards taking up new opportunities in terms of employability schemes or learning and training opportunities. Another area that we're looking at funding programs in is apprenticeship support. So we typically have quite low take up of apprenticeships in this area of the country, so we really want to support that. So we're looking at schemes that really encourage apprenticeship take-ups, also support for people that are in apprenticeships to remain in apprenticeships. So if you happen to work in that area or interested in that area, you know, we'd love to hear about ideas for programs of support around that. Another one is young people that are not in employment, educational training, or NEET as the terminology is known. We really want to look at skills programs that can support young people to be able to have some sort of intensive intervention and support them into employment opportunities, training opportunities and education, and re-engage those young people. And lastly, the 4th area that we're looking at funding is what we're calling stackable modular training. And that's more for people that are in work, and it's addressing some of those industry gaps, whether or not you work with a particular industry, or if you're whether that's in your own organisation or in an industry as a whole, looking at some skills gaps, whether that's emerging skills needs. It's you know, looking at those things like digital skills, which are quite important for upskilling workforce as well, and just addressing some of those needs to really support you know, our workforce across the west of England. So in order to support organisations, we've got a launch event coming up next week, which I will add into the chat. It's an hour and a half, it's in person. We're also going to put a recording up on our website as well for those that can't attend, and that is really the ins and outs of what are the requirements around the funding. And then in addition to that, we've also got 3 different facilitated networking events. So we really try to support organisations to come together, come up with great partnership building to really deliver programs of support that really kind of address different needs to really support people with these different skills programs and the target groups that you're trying to reach. So some organizations might be quite small. Maybe for example, you work for a really small organization and this is quite a large grant to manage, would be, or you have an idea but you don't have necessarily a training arm of your organisation. This is an opportunity to come along and meet with skills providers, a training provider, and discuss potential opportunities where you could team up and deliver a programme together. It's also an opportunity if you yourselves have an idea and you want to to put that to a training provider, that they put the program on, they deliver it, but you can potentially feed into that with your cohort or client group that you work with, or your own colleagues in workforce, for example. That's also an opportunity. So these facilitated networking events, so really try to support organisations to basically feed into each other's work and build programs of support in a joint way. I'll add all the details into the chat. There is Eventbrite to sign up to any of those events. Please do share it widely with your network or within your organisation as well, because it's a great opportunity to develop skills in the region. Thank you, Mark.
Thanks,
if anyone's
Jessie.
got any questions.
Right, thanks. Martin, I know you've got to go. Did you want to say a few words before you shoot off, or did you?
Yeah. Okay. Well, okay. Very brief. I mean, we work. Community 67 works predominantly in Keynsham South, which has got some issues around disadvantage. So I suppose the key offer we can do, we're not is offer a base for anybody that wants to do work, particularly in our area. We've obviously got links with local networks, and we can deliver in other agencies because we are a charity. My email's in the chat, so if anyone wants to get in contact and work with us, please get in touch with us. But thanks for the opportunity, Mark.
Thanks for coming along, Martin. Thank you. Hi, Katrina. I've got you next on the screen.
Thank you. So yeah, Katrina Kelly from the University of Bath. I lead on community engagement for the university. So the three things that I thought would be useful just to share. So the first one I'll pop in the chat, but allows charities to self-register volunteer opportunities to students and staff. So that could be useful to quite a few of you. The other thing I just wanted to highlight, quite a few of you mentioning about the groups that you're working with and the various services that you're referring them to. A project we're involved in at the moment is Soma Valley Rediscovered. So working across the sort of Midsummer, Radstock, Poulton areas. And at the moment, there's a 2-year programme of green prescribing starting. I'm just going to pop in the chat again. This is run through EcoWild. They have a taster day coming up this Thursday, and it's self-referral for the taster day or for the prescribing, which are 6-week-long programs, and it's open to anybody who really could just do with a little bit of space in their week to connect with nature and see other people. So please do refer to that if you have people you think would benefit from it in that area. And then finally, really just to share my contact with all of you, because if you're working in an area where funding comes up for research that would benefit you, that you need a research partner in, then I can help connect you to relevant researchers at the university. So please do get in touch with me. I know the university can be very difficult to navigate, so I can support in doing that and finding the people who are relevant to your area. That's me, short and sweet.
Thanks, Katrina. That's great. Donna, over to you now. Donna O'Brien.
Hi, thanks, Mark. Hi, everybody. Nice to meet you all. My background is that I'm running a support service for on the whole elderly people in Bath, Keynsham, Midsummer Norton area. My background is that I've worked as a community nurse for probably about 20 years, a bit longer than even maybe longer. I'm currently still working part-time as a community matron under HCRG, but I also about 4 years ago set up a service similar to this in the area, which provided as the same service, sort of support, practical support and companionship for elderly and vulnerable people. I've actually recently left that and set up on my own. So it's, although it's a new service, I have been running a similar service for, like I say, about 4 years. The service is a sort of a low-level support for people who don't necessarily want or feel the need for carers. Sometimes it can run in adjacent to, but people who really feel they need a low level of support for them to remain independent in their own homes. So the help we provide is taking people out and about to, whether they want to go to a garden centre, to appointments, as I say, companionship, also practical house around their house, help with admin support, anything that they need really. Our visit is a paid service. The visits are longer than a carer's visit, so 1.5 hour minimum is what we recommend, 1.5 to 2 hours, and it would be a regular visit. Usually we do ad hoc visits as well, but generally our clients have a visit maybe once or twice a week, and like I say, they're longer visits. The same person visits them every week, and I do a little bit of matchmaking to make sure that the right type of person. So if they want somebody who's really bubbly, or somebody who's just maybe a more gentle nature, and also the skills sort of matched up, so that it's a really beneficial service to the people that we help. And a lot of it is also with the social support, so that as we all know, a lot of people are isolated and suffer with loneliness and isolation. So in addition to the practical support, the social support is a really important part of our role. So I'm really grateful to make myself known to you and introduce myself to you all. I just want to say to Laura that I did use Cool Ventures. Amazing. I went to quite a few of your education sessions and found it really, really helpful. So it was really nice to say hi. And I think I went to a networking event in Keynsham as well. And yeah, really brilliant Cool Ventures support I've had along the way while I've been setting up on my own, because it was quite a steep learning curve, but really grateful to Cool Ventures. I think, yeah, that's it. We do receive referrals from the Stroke Association, Alzheimer's Society, GPs, families of people, and people can obviously contact us directly. I've put my contact details in the chat. And in my previous role we did have a client who we used to support to come up to the cycling event at Odd Downs. So and I can only say what an amazing service that was as well. So it's really nice. So I have got some contacts. I feel like a lot of you are charity, and obviously my service is a paid service, but I think we have got capacity in a lot of these areas, and it's just really raising awareness of our service. And hopefully, we've got some great people working for us. They're not like I say, trained carers. A lot of them, it's just really people with the right attitude, with some sort of life experience and common sense. We do provide some dementia awareness training for all of our employees. So people with sort of low level dementia, we can definitely help with also giving carer respite as well. So thank you very much for allowing me to come to your meeting today. Hi, Liz.
Thanks, Donna. That's really helpful. Melanie, over to you.
Oh, sorry, Liz has just got a message there, Mark.
Sorry, I
question.
didn't see Liz put her hand up.
Donna, thank you for your lovely kind words about what we do at the circuit, which is really nice. I didn't catch the name of your business.
Well, I probably didn't say it actually, did I? It's called Companions Who Care.
Thank you.
Yeah, that's fine. I have put it in the chat. Shall I put it in again? Because I think it was in the last one. So I'll just pop my email message in again. Website. Thank you.
Thanks, Liz. Thanks, Donna. Any other questions? No.
It's just say thank you, Donna, for your lovely. I thought I recognized your name.
Yeah,
so, yeah, it was lovely to meet you there at the Keynsham networking
Thank you so
session.
much. Yeah, it was really great. I also had some one-to-one session with employee advisor Emma Smith as well as going to the session. So I can really recommend, if anybody's setting up a business or a venture, Cool Ventures are, it's a really great service, or great help for me anyway.
Yeah. Thank you.
That's great. Thank you both. Right, Melanie, over to you.
Thanks, Mark. Afternoon, everybody. Okay, yeah, it's been really interesting listening to what everybody said. I know pretty much most of what you do already, but it's really good just to hear about new initiatives and things happening. Okay, so I'm Melanie Hodgson. Please call me Mel, otherwise I'll think, Melanie, what have I done wrong? Certainly got my attention there, Mark. So I work for the council, Bath and North East Somerset Council, and I manage a service called Live Well Baines, which some of you may know about. Although we work for the council, it's an impartial service, and also a statutory service. I think probably what would be best would be to show you, because it's a web-based resource. Now, hopefully, so look, let me just click on that. So hopefully you should be able to see the homepage of Live Well Baines. So if somebody could nod or put a thumbs up or something, yeah, great. Okay. What I'm going to do is a whistle-stop tour, because there's lots of us, and I'm sure there's some more people left to speak as well, and we don't want to run over our next 40 minutes. Okay, so the point of Live Well Baines is to provide information, support and signposting when people need it, because it's a website, it's always available. If somebody has a crisis at 3 o'clock in the morning, the information's there. It's driven by legislation, which I won't go into now, and it exists specifically for 3 groups of people. So we have families. So this is the universal family information. Its point is of all of the information on here is to also be preventative, so people can have choice of information, and it can also help prevent things from escalating, where they may need more complex support or intervention or social care assessment, admission to care home, hospital, etc. The aim is to help prevent that where possible. So with children and families, there is, what I'll do is, I'll put a link in the chat so people can go away. You can all go away and have a look as well, because there's so much on here that I could talk about it all day. This is the universal family stuff. There's a search bar, and it's also split into sections, where we try to be as intuitive as possible. We've also worked with groups of people, groups of young people, families, older people, to say, what do we want on here? You tell us, it's for you. So we've got parenting support, and again, they're split into sections, which I won't go through because there's so many, but have a look yourselves. Food support. We have a new Summer Valley breastfeeding network, so lots of different things there. Early help, which is specifically for families with a newborn, so very early support there. Let me just go back. Keeping safe, family services, cost of living, which I'll talk a little bit more about in a moment. Childcare, which is very, very popular. With parents, so we're the full range of childcare information, or Ofsted registered, so people can have that assurance that everything is Ofsted registered and inspected. A special section for young people, which we worked with a group of young people to develop. Everything a young person may need is there. Again, within each file, there's tons of other stuff. Safeguarding as well, which is something that if there is something that needs a safeguarding alert made, or someone's worried, there's information there as well. That's the children's universal family stuff. So, and adults. So this is for any adult who needs care or support. So that could be somebody who's older and frail. It could be somebody with physical or sensory impairment. It could be somebody with mental health issue. It could be somebody with a physical disability, alcohol, drug misuse. So anybody who may need some care or support, whether temporary or permanently. And there's a range of information here. Information for carers, where we link to the carers centre and other carers or services. Lots of different things on here. Hopefully the sections are intuitive, say what they do, do what they say on the tin, so to speak. And also what we were finding is people were often coming to the site thinking, I don't know what I want, does mum need a care home, or do we need care at home? I'm not sure. So we devised this section here, which is unsure where to start, and it's what the person would do then, or with their family member or carer, is to go through. So if we just pick a section here, you can pick as many as you like, then that will ask a series of questions, and then at the end of those questions provide a bespoke list of information for that person's needs. this is a very, very, very quick tour. And then finally, the Send Local Office. That is a statutory duty we have to provide information. SEND stands for Special Educational Needs of Disability. So we have, this is our Send Local Offer. Again, loads of stuff on here. So this is information, targeted specialist information for families with a child or young person aged up to 25, that's the legislation, with an additional need. And so everything on here is specifically for those families. So it's sort of a sister site to the Universal Family Information. What I won't do is, again, go through it because I don't want to hog the limelight, but we manage the Rainbow Resource Scheme, which some of you may know about. If not, then read more. It's a scheme where if a child or young person has an additional need, and the form explains what that means and how you need to evidence that, they will have a free card. It's like a credit card size card, like our Council's Discovery card, and they get concessions from all of these places. So that's really popular. We have about 1,500 members in BANES. So have a look at that. Loads of different things. We also have some tools for professionals on here, for professionals and SENCOs who work in schools. Lots and lots of autism and ADHD information, because that's one of the topics that a lot of people come to us for information about. So we've drawn those out and have some special information there about that for both the person with autism and their parent, carer, family, and autism, girls and autism, and so on. I mean, I could talk a lot about all of this. So just to finish off, we have about 20,000 visits per month to Live Well BANES, roughly. That's an average. Anybody wishing to do so, for example, Donna, you may wish to add your service here. You just click on add your service, fill in the form there. It takes about 5 minutes. It will then come through to one of my team to moderate it, and then on you go. And you will get contacted roughly every 6 months to say, is everything still up to date? Anything changed? So we make sure that everything on here is up to date. There's nothing worse than a website where you know it's all out of date. I think what I'll finish on is also contact us, and there's a range of options here, how people can contact us, why they wish to contact us. Cost of living, that's affecting everybody, some people a lot more than others. We have a range of supporting information here, this is very, very popular. And there's so much of it. We split it into concertinas, so depending, and it's all ages as well. So some maybe childcare cost, pension credit, debt advice, and so on, money and mental health carers. We also signpost people to the hub if they want to speak to somebody further. You've got quiz in here, so the lady from Clean Slate, you can see we've got quite a lot of you on here. If you're not on here, get registered. How we tell people about us is we use social media a lot. Well, let me just stop sharing that. We use we've got a very, very active Facebook page, which I'll just quickly go to. I'm not sure if I'm sharing it now or not. I'm not sure whether you can see it. Let's have a look. Bear with me.
No, there we go. Yeah, sharing now.
Yeah, okay. I will wrap this up because I'm sure there's other people who want to speak. But yeah, so we share a range of things which is for SEND families. It could be for older people, like a lunch club for older people. This is for people going on holiday with a child with additional needs. There's tons of stuff on there, and we get really, really good engagement with all ages of people, whether it's adults, carers, families, and I mean, there's tons of other things I could say, but what I would ask is have a look. If there's anything missing or you want to be added or your service to be promoted via Facebook, because we do that quite often, we're happy to do that for you. And yeah, that's us. So yeah, I think I'll stop now, but any questions, I don't know whether you want to take those now or later or whether we've got time. So thanks for listening.
Just conscious we've got about 5 minutes left. We've got 1 or 2 people to speak, but that's really useful. It's really, really helpful to know that you do those checks every 6 months to keep the information up to date, which is brilliant. Thank you, Melanie. Karen, are you still with us? Karen McDonald?
Yep, I'm here.
Karen, hi.
I'll just give her 1 minute. Oh, I have put my camera on. I don't know why it's not working. Anyway, I have put a little piece in the chat line. Really, it's just to take this opportunity to explain that we are an independent charity. A lot of people think that Crime Stoppers is part of the police or part of Crime Watch on the TV, and we're neither. We're a completely independent charity, and it's worthwhile knowing for your own sake, but also for people you're working with in the community. If they're very fearful about crime that's happening around them, but they're too scared to go to the police, we offer 100% guarantee of anonymity. And I put it in the chat line, a link to one of our sort of landing pages, which might be quite useful. And also for young people, I mean, for both Fearless, which is a young person section, and Crime Stoppers, what we're all about is being able to be an active bystander and able to speak up about crime that's going on, but feel safe to do so and try and make a difference in people's communities, really. So I'm happy if anyone wants to reach out to me to speak to groups that you're working with online, probably online, because I do cover a huge area. But I'm happy to do that, or send leaflets or anything like that sort of thing. And if you go on the Fearless site, if you work with young people, there's a professionals tab at the top, and you can download free resources or request free resources. So yeah, I'll move on because I know you're very short of time. Thank you.
Thank you, Karen. I think that's covered everybody in terms of speaking. I want to say thank you for bearing with us today with the technology issues we've had, but hopefully next time we'll get all of that sorted. I wanted to let the last word go to Alison. I just wanted Alison to say a few words about Interagency Bulletin that she does a fantastic job on, and just how you can give information to her to promote within that bulletin as well as on these meetings. Hi, Alison.
Thanks, Mark. Hi, everybody. And firstly, an apology because I'm a bit behind with the interagency bulletins at the moment due to other work pressures, but usually they come out monthly. I'm sure most of you are signed up to receive them. If you're not, I'll pop my details in the chat and we can sign you up. And any colleagues you want signed up as well. You can send me information to go in them. And in the interim between interagency bulletins, we have a funding journal which is kept up to date as far as possible and on our website, along with details of training and events, so that there's information always available on our website in between the bulletins. So I'll drop you a link to where that is as well, because a lot of people wait for the interagency bulletin to come out and think that's the only source of funding, whereas the funding journal is 700 pages of funding opportunities and all the very latest stuff. There's only a little snapshot held in that funding, in that interagency bulletin every month. So hopefully that makes sense. I know we're running out of time and I'm just in the middle of an email to IT to say, please don't reduce our Zoom licenses. And yeah, so I'll pop some information in the chat now for you, and Mark, we can send that out afterwards. Thank you.
Thanks, Alison, and thanks once again to everyone for joining us today, and I hope you have a pleasant afternoon, and we'll see you again soon.
Thank you.
Thanks, Mark. Bye, everybody.
Thank you very
Bye-bye.
much.
Thanks.
Bye.
Bye, everyone.
Bye.